Welcome everyone to the dissemination webinar of the London edition of this series of hackathon, to co-design and co-develop tech-based solution. And I'll give the floor to Anantiani.
Hi everyone. Thanks, Christina. So I'll just do a really brief overview of the Feast project, which is a sponsor for the hackathon. Next slide. So if we look at the contribution of diet to poor health, or the different risk factors to poor health, so that's the graph on the upper left. So what you have on the horizontal axis is different risk factors. And then on the y vertical axis, you have the deaths in millions. And you can see the dietary risks, which I've circled in red, are the biggest contributors to global deaths across any of the other risk factors, followed closely by high blood pressure, which is also caused by high salt intake. So that also has a dietary link. And if you then disaggregate the dietary risk factors into the different components of diets, which is the graph on the left, you can see these different elements: low grain, high sodium, low fruits and seeds. What contribution they make to morbidity and mortality. And the reason for showing these graphs is basically just to highlight that dietary risk factors and poor diet are a major contributor to poor health across the world, and certainly in the UK as well. And for people with learning differences, sometimes they have a genetic predisposition, so that any dietary risks are actually compounded for them, and it increases the chances that they'll develop diseases like high blood pressure, type 2 diabetes, cardiovascular disease. Next slide. And if we look at the EU generally, about 100 million people were at risk of poverty or social exclusion, and about 10% of people in the EU could not afford a proper meal. These stats are similar in the UK as well. Next slide. And if we look generally at our food systems and we look at the key stakeholders in our food systems, we have people, we have the public sector or society, we have the environment, and then we have the large multinational corporations. So the people are losing because, as shown previously, the poor diets lead to a major and significant burden of disease. So about 75% of all diseases in Europe are due to these non-communicable diseases: high blood pressure, diabetes, obesity, overweight, cardiovascular disease, all of which have a strong root in poor diets. And 85% of all deaths in Europe are linked to these NCDs. And they're also an important driver of embedding health inequalities. And then if you look at public sector or society, across EU governments, we spend 700 billion euros every year treating these NCDs. In the UK, that number is about 127 billion pounds every year we're spending on these completely preventable conditions. So it's not to say that we shouldn't invest in health, but it is to say that we're not actually preventing or investing in health. We're just preventing the exacerbation of sickness. If we're looking at the environment, the food systems have a major contribution role to play in driving poor environments. So it's about 30% of global greenhouse gas emissions, 50% of land use, 70% of fresh water use, almost 80% of eutrophication, 60% of biodiversity loss. The only real entities that are winning are the large multinationals. And they're making a lot of money off of how our food systems are currently set up. And it's not to say the private sector generally, because a lot of small businesses are actually struggling, small farmers are struggling. It's just the large entities that are actually benefiting from the way our food systems are currently set up. Next slide. So for Feast, we don't want anybody to lose, but we also don't want the multinationals to win on expense of all of the other key entities in our food systems. And what we would want is for everyone to win. We want the multinationals to win as well, but rather than delivering sickness and environmental harm, let's try to shift our food system so that we're actually delivering a win for everyone. And our kind of strapline is we want to make it easy for every person in Europe to eat a delicious, healthier, more sustainable diet. So a few nuances around this. Firstly, we say every person, so not just looking at citizens, but all people in Europe. Secondly, we want to make it easy. So a lot of times the stance is that people need to change their behavior. But people could have the knowledge about a healthy diet, but if they don't have the opportunities, the access, the availability, the affordability to eat a healthier, more sustainable diet, they could have the knowledge, but they won't be able to change their behavior simply because the other system elements don't actually allow it. So the example I give of this is Tower Hamlets, which is a borough in London. And Tower Hamlets is a childhood obesity problem, and they also happen to have 42 fried chicken shops per secondary school. So you can educate these kids, but unless you actually change the environment and what's available to them, you're not actually going to help them shift to eating a healthier, more sustainable diet. And then finally, we say a delicious, healthier, and more sustainable diet. So it has to taste good. We can't just focus on health and sustainability, and the food tastes like doesn't taste good because people won't eat it. And healthier and more sustainable. So what we do not advocate for is that everybody become a vegan overnight, but what we do advocate for is that people transition to a healthier, more sustainable diet over time. Next slide. So this is our awesome consortium. We have 15 European countries represented, including the UK, 35 partners and 13 living labs. So the living labs are the means by which we can not just be an academic project, but actually have a real practical element and component of working with people on the ground to understand the problems better than also co-design solutions, of which this hackathon is one of the representatives of that. Next slide. I think that might be my last slide. Yep.
Yes.
Over to you.
Thank you, Anand. So thank you for everyone that has just joined. I'm Cristina Biella. I'm project manager for OpenDot in FIST, and OpenDot is an innovation hub set in Milan for social impact. And we mainly work in the field of health and care and food system and circular design. And we do basically co-design, and what you will see today is our method used inside the FIST project. And in Milan, we have also a Fab Lab, so you can see a part of it in the picture. And we use this Fab Lab to do rapid prototyping and to use digital fabrication to, of course, prototype solutions that address specific needs. So we basically are a facilitator of innovation, and this is also our role inside of FIST. And for this project, we decided to host a series of hackathons in many cities of Europe. And the hackathon is basically a short-time event in which a series of teams compete each other to find solutions to specific challenges. But it is not also an event in which there is competition, but it's also, there is also a lot of collaboration. The teams collaborate each others, of course, and also with experts in the field, and of course with experts about technology. And the main goal of this World Series is to co-design new innovative solutions and tech-based solutions. And we already had a series of events. We had an edition in Milan, and you can find the dissemination webinar inside the YouTube channel of FIST. And this is, of course, the dissemination webinar for the London edition. And we already did a Kaunas edition in September and a Berlin edition in November. So please check the website of FIST and subscribe to FIST YouTube channel to keep updated about these editions. And we will have also a final event in Copenhagen the next year. I'll give you some information at the end of this call. And for the London edition, our second edition, we decided to collaborate with King's Health Partners and with the Health Innovation Network of South London and the NHS of Southeast London. And with them, we decided to work and support people with learning difficulties and their families, their carers, and also the doctors that are working with them to help them to live healthier lifestyles and adopt healthier diets. And the edition goes really well, and so the jury decided to give the victory to basically two teams. So we have two solutions from these editions. And let me give the floor to Haley Romandin, that is our reference inside the King's Health Partners. And I think Haley.
Lovely. Thanks, Christina. Hi, all. So yes, I'm Haley. I work for something called the South East London Integrated Care System, which brings together all of the health and care and voluntary sector organisations that are looking after the health and well-being of our really kind of diverse population of South East London. So we are part of London, obviously. We have 6 boroughs that sort of straddle inner and outer London. And we have a really kind of culturally diverse population of about 1.9 million people, many of whom live in contexts of deprivation. So, and we've got really kind of gaps at a kind of neighbourhood or street level between people in the kind of lowest decile areas and wealthier areas. So that kind of adds a layer to the level of inequalities that we have in our patch. I also work for an organisation called King's Health Partners. We're an academic health science centre, and our role is to translate research and innovation into clinical care to improve health outcomes and health equity for South East London population, and also spread that research and innovation globally. And we also had a third partner, as Christina mentioned, that worked with us, which is the Health Innovation Network of South London. We have health and innovation networks across the UK, and they focus on spread and scale of innovation too. And we have a really kind of exciting program of work that we focused on around healthy weight. So in South East London, we have around about 32% of our of people with a recorded body mass index who are registered with a primary care organisation who are living with overweight, and we have about 27% of those people living with what we would determine to be obesity. And as Anand mentioned at the beginning, we know that people with learning disabilities and learning differences are more likely to experience living with overweight or obesity than the general population. And there's a raft of factors that drive that. But obviously part of our approach is really thinking about how we can work and co-produce ways of supporting people living with learning disabilities to eat healthier. And that's part of our approach to ensuring that we're enabling everyone in South East London to live as healthy a life for as long as they can, and really kind of closing the gap on the systemic inequalities that we have in South East London and also in London as well. So that's sort of what prompted the challenge of what we were focused on in the room, which, as we said, is around supporting adults with learning differences to who are living with excess weight to have healthier food choices. We've also got some work around children and young people in our patch as well, because we know that we need to be looking at the kind of whole life course, but to try and keep the scope focused and enable us to come up with kind of solutions that we could prototype. We tried to keep the kind of scope focused to a particular challenge and a kind of particular population group of relevance to us.
Thank you. Thank you so much. So the first solutions and the first team, let me just say that the teams were composed by young students, designers, but also experts in the field. We helped those teams in the past months to construct this prototype and to develop the solutions. And today for Cooking Connection, we have our digital fabrication expert, Emma Pareschi from the lab. And
yes, I'm here. Perfect. Thank you, Cristina. So, good morning, everyone. And I'm here today to speak about Cooking Connections. So, Cooking Connections is a method kit to co-design structured, inclusive, and engaging food activities, fostering hands-on and impactful learning experience for people with learning difficulties. What does it mean? So actually, Cooking Connections is a booklet that contains guidelines, instructions, but also board and sheet that can be used to organize and plan cooking classes, cooking programs addressed to adults with learning difficulties. To give you an idea of the insight of Cooking Connection, we can actually play a video. Thank you. So who is it for? Who is supposed to use Cooking Connections? So if you are an organization, a community center, healthcare specialist, a therapist, a caregiver, or a volunteer who would like to organize and to offer cooking classes to adults with learning disabilities, well, the Cooking Connections can help you to do so. Why? Because the Cooking Connections contains activities that allow you to organize such a program, a cooking program, not only for adults with learning disabilities, but actually with them. The idea behind Cooking Connections is the fact that people with such difficulties are actually the expert of their condition, and their input is essential to guarantee the organization of Cooking Connection classes for their specific needs and preferences. The idea to have such an activity to organize and plan with them is actually what we call co-design. So a process to design in a collaborative way an activity like a class or a lesson. So the idea is to create the right environment and to have the right tools to work from the side of the organizers, but also working with actually the target of your activity altogether to define the details, the goals, the tools for a cooking class. Next slide. What you find inside the cooking connections. Inside you find clear instructions and input for health experts and caregivers who want to manage co-design activities, including the setting, how to organize the space, including how to manage time, including also how to manage and to facilitate conversations and create an active environment, how to ask questions. Then you find board and hoc tools for actually the activities itself. Then you can also find a step-by-step instructions to complete an activity plan. So at the end, the goal is to have an activity plan about cooking classes. And then you also find impact assessment sheet that will help you to understand the level and the kind of impact that you can reach with cooking connections and with the cooking class. And then you find inspirations, examples of activities, but also healthy recipe tips, and where you can actually find more of them. Next. So inside, so cooking connections will guide you to organize co-design activities that are organized, and the core activities is actually made of three parts. The first part that is actually the activity that are run with the target group, with adults with learning disabilities, want to investigate the cooking and eating habit of our adults. So to understand what are their habits, to investigate their habit, their skill levels, their confidence, what are actually the challenges that they face while cooking or while collecting the ingredient, and also to investigate what are the best tools and the best support that they could need to actually have an healthy diet and to be able to cook healthy food. The second part of the core is actually to understand the goals and the objectives that the participant of the cooking class would like to achieve, and what are the outcomes expected by such an activity. And the last core part is dedicated to the definition of the key features of the cooking and the eat class. This part is actually very practical. It covers a practical aspect of the cooking class. For example, the space, where what is a good space to actually participate and run a cooking class, and the time when the cooking class can be organized. And this is actually the core design activities. And in Cooking Connections, you will find the instructions how to run such an activities and how to collect the information. There is also a final, a conclusion part of the co-design process that will help the organizers to actually gather all the input and use them to create an actual activity plan of a cooking class. What is also really important is the impact that you can achieve through these activities. And we identified 2 levels of impact for health specialists and the caregivers. So to create a safe and supportive learning environment, and to improve cooking confidence, and how high is the involvement of the participant, and how to identify in the right way the participant abilities when it's about time to cook. And then there is also a part dedicated to the measuring of impact for the participant. So their level of satisfaction for a practical and effective learning activity, but also understand and be able to measure their cooking confidence, and also their the social interactions, if there is an increase of social interactions through such an activities. The Cooking Connections toolkit is available online. You can download it. Actually, you are very welcome, and you are invited to download it, to check it, and of course to test it. And we are really happy to collect any feedback. So if you download, just read it, or you use it, please send us your feedback, and we will be really happy to read them.
Yeah, we will put the link to download in the comments, so you will be able to download it and test it and send feedback. Thank you so much, Emma.
Thank you.
So let's see if we have questions about this first solution, or comments, or anything. Okay, I think there is an end.
Haley, please.
Okay, please, Haley.
Thank you. Thanks, that was really, really helpful. And I know the teams worked really hard on making this sort of a usable kind of facilitator guide, because I know obviously when we saw the prototype it was quite complex. So I think it's looking really, really great. Have the team thought about sort of how they're actually going to kind of test it in real world with kind of community groups or anything like that?
Yes. No, but I can say yes. I can say that during the phase of prototyping the toolkit, working on the toolkit, it was a continuous wish and to be able to test it, and to understand actually how this board, and I believe that at the base there was a lot of curiosity, and also the willing to actually use it in directly, not only ask to someone else to use it, but there was also the will to, okay, I want to use it, I want to test it, especially from the expert part of our team. We decided to wait until the toolkit was finished before to actually test it, because we believe that this need to be well structured as a co-design process. So it's really important to follow the process and to be able to then collect all the insight from the activities to actually get a plan for the activity. So it was definitely necessary to conclude this phase. Then yes, there is the wish to be able to test it.
Great. And so we're just out for procurement at the moment for a provider to deliver some weight management provision for people with learning disabilities across 3 of the boroughs in South East London. And I know Gillian is involved in that, who was involved in one of the teams. So I think that would be a really great opportunity for us to think about how we test it and kind of nestle it into that program.
Yes.
Thank you.
Thank you.
Really. Okay, so I think we can go to the other winning solution. So NutriNest, the team is we have inside the team both product designer, social innovation designer, and of course also health expert. Today we have online some of the designer team. And is online also Andrea Ascani, that is the mentor for OpenDot for this project, that is product design tool and digital fabrication expert. And so I think that Pietro, you are here. Okay.
Yes.
I'll give the floor. Okay, to you.
Okay. So good morning, everyone. I'd like to present to you NutriNest, which is a physical toolkit with inclusive kitchen basics, which includes two chopping boards and an ingredients measuring tools, which has a clear visual cues. During the hackathon, we had many ideas of services and digital tools, but none of them seemed to be concretely useful until we started to think about tangible instruments. This intuition brought us to a more real brainstorming, and we all believe that the strength of our project stems from its realness, meaning that if you can experience it physically, then your experience of it will be much more impactful. And of course, we can have a look at the video, which explains a little bit more better what we did. And so please, next slide. So as you saw into the video, we have gone through a lot of experimentation and trial and errors. So let's begin by revisiting the prototyping phase, which was a period that was as challenging as it was transformative. As with any innovative endeavor, this stage was filled with obstacles, of course, and every hurdle, however, presented a valuable opportunity for learning and growth. Also, by adopting a rigorous trial and error approach, we managed to refine and sharpen our problem-solving skills. And during this phase, we had the opportunity to use the industrial equipment, such as the CNC milling and the 3D printing tools from OpenDot. And we also experimented for a long time with silicon casting, as Andrea can remember. And so if you can go to the next slide, and I will leave the microphone to Manal.
Hi everyone, I'm Manal. So now moving on to our target users who are truly at the heart of this project. Our kit is specifically designed to meet the needs of individuals with learning differences. This audience inspired us to create something that could make a tangible and lasting difference in their lives. So the aim was to empower them by providing tools and technology that are both accessible and meaningful. These interactions were invaluable as they provided us with insights that helped to shape the design and functionality of our kit. Next slide, please. So the result is a product that is intuitive, practical, and above all user-friendly. So our ultimate hope is that this kit will not only offer a sense of independence and confidence to its user, but also enhance the quality of life. Next slide, please, and I'll hand it over to Sylvia.
Hi, everyone. As you can see from the pictures, these are the completed prototypes along with customization made by laser engraving and completed with the packaging, which was made entirely in recycled paper and with a very small amount of glue. Next slide, please. Okay. Finally, I'd like to discuss the production aspect of our project. One of the core principles guiding us is the commitment to openness and inclusivity. As this is an open source project, we have ensured that the entire development process is transparent and accessible. Our goal is to empower others to replicate, adapt, and even build up on our work. To make in-house production a reality for as many people as possible, we focused on using widely available materials and straightforward manufacturing techniques. Our documentation is comprehensive, featuring detailed instruction, reduced lists, and give tips to allow everyone to build the kit themselves. We believe this approach not only democratizes access, but also fosters a spirit of collaboration and innovation, amplifying the impact and reach of our work beyond what we could achieve alone. And we have finished.
Thank you. Thank you, team. So also for NutriNest, if okay, I raise your hand. Feel free to speak. Sorry, I can't see you, so.
Yeah, I just had a quick question. It was just around the material that you use. And I know you said you went through a bit of a process to pick that and select it. But I just wonder, what was it that in the end made you go with that material?
Sorry, I think the connection went a little bit down. Can you please repeat the last part of the question?
So the material you selected for like the chopping board and the instruments, what was it that made you go for that specifically in the end? Was it just preference, or was it durability, or was it recycled material? Okay,
I think I can start to answer the question, but if other people from the team wants to add, feel free, of course. So as you can see, there are 3 different materials, mainly 4 different materials in the production. And each material was chosen based on the function that it has to of course, to fulfill, exactly. So, for example, the wooden chopping board is treated with an analergic oil, which means that it doesn't contain any nut oil or similar. And so, for example, this is designed in order to cut dry foods. So, for example, bread, and it is aligned with the HACCP normative. And the same is for the silicone dosing tool, measuring tool, which is made out of silicone because of the malleability. Okay, so if you want to measure an ingredient into this cup and then to pour it into another bigger cup, for example, you can kind of squeeze it and in order to avoid any problem and I'd say to dirty the kitchen.
Great.
Okay.
Also, another note I want to add to Pietro, what Pietro just talked about is the durability of these materials. So, of course, materials that we're using for the wooden chopping board, we were thinking of using bamboo wood, but we are also open when it comes to scalability. We are also open to looking for other materials which are more sustainable. But again, these are the materials which would be easier to use and more efficient in what they aim to provide.
Great, thank you.
Other questions? Okay.
I think Haley and myself have hands raised as well.
Okay.
Haley, do you want to go?
That's all right, Annette, you've been waiting. You go first.
Cool. Fantastic job to both teams. Two questions. One for NutriNest. Have you tried cooking anything using the kit, and if so, what was it? And then the second question, I think for both NutriNest and Cooking Connections, I can see that actually NutriNest could almost be like a facilitative tool for Cooking Connections, and so whether or not there might be an opportunity to create or modify Cooking Connections so that it integrates the NutriNest in some way. But just a thought. I also know that the scaling and the production for NutriNest obviously is going to be more costly than Cooking Connections, but it's just a thought, and whether the teams had any discussions along those lines.
Talking about the NutriNest question, yes, we didn't try to do a complete recipe, of course, but we tried to use the tools, of course, to see if they work. For example, we had some. I don't think that there are these pictures in the presentation, but we also are. Oh yeah, this one, the test, exactly. Here, for example, we have a previous version of the wooden chopping board, in which we tried to see if the texture was to be laser engraved or just or it needs to be more deep, for example. And so yes, we definitely tried to test it, exactly. And I think that we tried the most with the chopping boards. But for the measuring tool, I think we can definitely have some more trial.
Yes, and about Cooking Connections, I believe that to be able to integrate such a tool within a cooking class program, that would be a way actually to complete the activity, to complete also actually to give extra support for such an activity. So Cooking Connections, yes, it's a tool for facilitate the organization of a class, of a lesson. So the idea is also to give not only support during the organization, but the insight of the co-design are then translated in the lesson itself. So to give the possibility also to the possibility to suggest, but also to provide not only with activities, not only with the time schedule or indications about the recipes and the ingredient, but also with the physical tools that can help the physical activity of cooking. That would be fantastic. I believe that Cooking Connections, in terms of scalability, well, it's a digital. It comes as a digital tools that can be printed. Actually, some of the part of the Cooking Connections need to be printed to be used. So it's I find easier in terms of sharing and scalability of such a tool as a digital connection. So we wait for actually the instructions and the guidelines to be able to then include them with Cooking Connections to enrich the resources that we can provide for such an activities.
Thank you, Anna.
I hope I answered the question.
Okay, so about the next steps, as we already...
I think Haley still has her hand raised.
Oh yeah, sorry.
That's okay, Christina. So I think we all acknowledge the scalability, and I think it'd be great to see the NutriNest product being available via open source, to see what opportunities there are to kind of increase that scalability by reducing the kind of cost, because obviously the cost of production in a fab lab is just, you know, because of the units, is not necessarily sustainable for us to then think about how we would complement the two. But I think we can definitely start to have some conversations locally about that. I guess the only other question I had is, I know you flashed up some recipe cards when you were doing your presentation, and my question was, does the meal kit come with those recipe cards as well, or was that sort of just a visual aid? And if so, I know that when we had the hackathon, we talked a lot about making sure that the recipes were tailored to people with learning disabilities, but also tailored to our global majority populations as well, making sure that they were sort of culturally diverse, and not just sort of for a white European sort of target market. So just had a question around whether that actually came to fruition in the prototyping.
Yeah, I think, you know, when we started out, there was definitely, you know, we wanted our recipe base to be, and our information base to be very diverse, but just for the purpose of, you know, exemplifying what exactly are we using, you know, when it comes to these recipe cards. We did come up with a few recipes, but we plan to add on more, you know, from different cultures and from different cuisines. So there's more to come. But these are just how we started out with. Again, these are easy recipes. And if you can see, there are a few visual aids as well. So like, it's not like a conventional recipe, which is all printed. You have ingredients, you have how they will look, you have how they are measured, so that it's easier for people with learning differences to adapt and to use in their kitchens.
Haley, just a quick question for you. Actually, have you seen the NHS England recipe bank? I only recently discovered this. Recently, mean like a couple of weeks ago.
Yeah.
But I wonder if it might be interesting to collaborate with the folks that are creating that for all of these initiatives as well. Do you know any of the folks there? Do you know the recipe bank?
So I know of the recipe bank because I think that came up on the hackathon. I think someone actually Googled it and came across it when we were doing the hackathon. I don't know who has pulled it together. I suspect it's probably some sort of collaboration with a large charity rather than the kind of NHS England doing it off their own back. But we can certainly find out. We've got lots of contacts within the public health departments within NHS England, and I'm sure it's probably something sitting there, so I can pick that up. I think it's a really good suggestion.
Yeah, actually the link is also in Cooking Connection now, so if you will download the kit, you will find also the link to this bank. I think there is another comment or question. Oh no, there is the link in the chat. Okay, perfect. Thank you, Camilla. So we already talked about next steps, but we will have also a final event in Copenhagen in March of the next year. We are collaborating with the Copenhagen Business School, and the idea is to have a fair in which we'll showcase, of course, the solutions and prototypes from the whole series of the hackathons. But we want also to create an occasion for network, basically, and show also other solutions from other food-related projects. But not only a fair, but also an occasion to have chats and active sessions about a series of topics about innovation in food system. So not only a fair and a showcase, but also an occasion for open discussion and meet people and disseminate also solutions from this project and other projects, and have an occasion to talk about food, but with multi-level stakeholders, so European projects, institutions, researchers, designers, and so on. So if there is not questions, here there are some contacts. So you can email both Anand or me. It really depends what do you want to talk about. And thank you so much, everyone.